Hello everyone, we have Pilar here. She's done a video in the past. She's actually had failed back surgery, a couple of back surgeries. And really quick, if you've had back surgery, chiropractic is safe. Not the traditional chiropractic techniques, but a technique called Cox Flexion Distraction Technique, and that's what you had.
Yes.
She hasn't seen me in 2.5 months. She had a really bad surgery or failed surgery back pain about a year or two ago.
Yeah, a year ago.
Yeah, and now she just sees me every couple of months just for maintenance care, but she's doing really well with that. So if you've had back surgery, discectomy, laminectomy, a disc fusion or a spinal fusion, this technique is safe for you, Cox Flexion Distraction Technique. So we're going to go into that in a minute, but she had asked me about, she's having some discomfort up here. She's a chef, by the way, and her restaurant is an Italian restaurant in the Essex Market. What's the name of it?
Mille Nonne.
Mille Nonne. I should know that because she's brought me food, delicious meatballs, and it's a healthy twist to Italian food. Delicious. Check it out, Essex Market. Now let's get into this here. So she has a flat back. Her back is not flat. A lot of people have a hunched over back, right? But some people have this flat back, and the reason for that is the vertebra actually shift forward because she's got her head down in the, cooking or doing whatever she's doing or being on her cell phone, and it pulls the vertebra here in between the shoulder blades forward. So the best muscle to strengthen for that, to develop that curve in the thoracic area and to stabilize this thoracic curve, and it should be a little bit rounded here, okay? And again, hers is a little too flat. So the best exercise for that is the serratus exercise. I'm going to show you how we do that right now. So you're just going to go like this and grab onto the band, and you're just going to do this. Keep your elbows in at your side, stand up with good posture, elongate the spine upwards. Very simple exercise. There's another few ways to strengthen the serratus anterior muscles, but this helps with thoracic stability.
Oh, okay, great.
So,
can I be like this?
yep, and you guys can see her from behind. She's got her elbows in at the side. No, you can still face that way. Yep. Yep. Look straight ahead with good posture. Good.
So what is the difference between like this and like this? Is there any difference?
It just hits a different area of the muscle, and you can actually do both. Okay. Palms in and palms out.
Okay, perfect. I can feel it in the back, that is.
Yeah, when you do palms down, it's hitting some of the rotator cuff muscles too.
Yes.
Which isn't a bad thing for you.
Yes, I can feel it.
Always good to strengthen those rotator cuff muscles. Yep.
Perfect.
Great. So do you have one of these bands?
I do.
Okay, great. All right, go ahead and lay down on your stomach. So again, if you've had surgery on your back, and whether it's a discectomy, a fusion, a laminectomy, or maybe something different, this is a really safe technique. A lot of people are afraid to go see a chiropractor after they've had back surgery, and I can understand that, especially if you don't know what chiropractic is. But there are plenty of very gentle chiropractic techniques that will not create any problems post-surgical or pre-surgical. So that main technique I'm speaking of, Cox Flexion Distraction Technique, obviously there are doctors or chiropractors that have the equipment, may not necessarily be certified. You want to make sure you go to somebody certified rather than just somebody that has the equipment, okay? And you can check out the certifications on coxtechnique.com, coxtechnic.com. But sometimes there are doctors that are certified, but if they haven't renewed it in the last 2 years, they may not be on that website. So you can just call and ask if they're certified, and they'll tell you, okay? Tender right there.
Yes.
Take a deep breath in. That's the glute medius attachment right here. Good. Now I'm going to have you lay on this side. We're going to do a little ART on the glutes. And if any of you have seen me do videos before, you've seen me do these videos with ART on the glute. It's really effective. Go ahead and swing that leg back.
Painful.
And a little painful. It's not so bad.
Yes.
It is bad?
No.
Okay.
It's much better than before.
The gain is better than the pain. Let's put it that way, okay?
Yes, for sure.
Good. So I'm actually doing ART not only on the glute medius, but the glute maximus, and the glute minimus, and the piriformis. So we're getting all the muscle groups in here. Good.
A year ago, I couldn't even be touched there. Do you remember?
Yeah. A year ago when I first saw her, she would jump. I mean, she wouldn't even be able to swing her leg like this. She was in really acute pain. So I can't stress this enough. If you've had back surgery, don't write off chiropractic. Don't do that. Just go to another chiropractor. I see this a lot. A lot of people say to me, or I'll see it on like social media, a chiropractor herniated my disc, or meanwhile they came in with severe back pain and pain down the leg, and they think the chiropractor herniated the disc. No. Extremely rare. It just can't happen. So, maybe go to another one, all right? Just like if you were to go to a bad dentist, would you write off dentistry? Would you not go to the dentist ever again? No. You would find a better dentist. Same thing with chiropractic. And turn over on the other side. So please don't make that foolish mistake, because then you're going to end up with much more severe and invasive treatments. And why would you want to do that? Because in the invasive treatments, you can't reverse them oftentimes. Once it's done, like surgery. Now, I wish I had gotten my hands on her before the surgery.
Me too.
Who knows?
Me too, I wish.
Now, who knows? Maybe I would have been able to save her from the surgery, but maybe not. I don't know that, right? But at least give it a try before getting surgery. And again, not just any chiropractor. If you've gone to one or two chiropractors, he didn't help you with the situation, maybe the problem is because it's neurological, you need another technique like Cox Flexion Distraction Technique. So I keep hitting home on this because I see this all over the internet. People just not giving it a chance, or just not going to the right doctor. That's all, the right chiropractor. And then just writing off the whole profession altogether. Okay, this leg, swing down a little bit towards the chair. So your foot towards the chair there. Yep. Okay. Good. Getting a little better already?
Yes.
Okay, lay on your stomach. Okay, now we're going to begin the flexion distraction, Cox Technique. So I've already gone through the protocols with her. We've been working with her for a long time now. As I said, she hasn't been in 2.5 months, and she puts a lot of stress on her body. She runs a restaurant. And are you still cooking? And
Yes.
yeah, so she does it all. And as you know, cooking is bending over the low counters. It's not easy on the back. So I'm really happy to hear that she's been doing great over the last 2.5 months, and that her complaint is more up here. That's a good thing for me, right? I don't want to hear her complaining about her back where she had surgery. You have not obviously had any surgery up here in the spine. So even though she's not having some back pain, we're going to do a little bit of flexion distraction to decompress the discs. And as you saw before, we just loosened up the glute muscles in the hips area, the back of the hip and the SI joint, sacroiliac joint. So we're just going to do some light flexion distraction here. And then we'll go up to the top of the neck there and the top of the shoulders and focus on that for her. How you doing there, okay?
Yes, perfect.
Yeah, and you don't have to have back pain to see a chiropractor or to get adjusted. Stiffness in the back is usually a warning sign that there's something off or misaligned in the back or the spine somewhere. And that's what we chiropractors call subluxations. That technique right there is called Thompson Technique. So I do mix them up a little bit. It's also a very gentle, light force technique that you can use for somebody that's had surgery. I may not use this technique if you just had surgery a couple weeks or months ago. Okay. All right, go ahead and turn over on your back. Okay, cross your arms here. Good. Tuck your chin down, deep breath in, come on up. And blow out. Good. And one more here. Okay. Let's see your hands up in the air. So I do this to check people's psoas muscle. What I'm looking for is one arm shorter than the other, and her left arm is shorter than the right. Not with every case, but that tells me that her psoas muscle is shorter or tighter on the same side. Again, it doesn't work with everybody. If you've had a shoulder injury, it may not work. So I'll usually go in and check both sides. And you're a little bit sensitive there.
Yes.
Okay. And you can bend your left leg. So I'm on a pasta diet for a week because I had a tooth bone graft done. See, I'm sharing some of my health issues here. The getting old, dentures and implants and stuff. Anyway, I had my bone graft done, so I can only eat soft food.
Okay. I'm actually off pasta
Are you?
for a while now. For about, I eat, cooking. I taste everything that I cook. So.
Okay.
But I've been trying to
Cut out the pasta.
Yeah, the pasta and the bread.
Yeah, I love my pasta and I love my gnocchi.
Yes, I love my pasta, I love my gnocchi a little bit too much.
Yeah. It's definitely one of my favorite things. But when you get a bone graft, you cannot eat rice or quinoa, which I love, because of the grains that get caught in there.
Yes, of course.
So it's got to be something soft and mushy. Even though I like my pasta al dente.
Yeah, I can imagine.
How about there? Is this tender right here?
It's a little bit less, but why does that get tender?
Why the left side? Maybe you're bent.
No, why does it get tender? Because of the position?
Well, oftentimes when it tightens, the psoas muscle runs along the spine from T12 actually, L1, L2, L3, L4, L5, all the way through the groin in the front here and into your hip. So all the way into the groin and the hip under there. So it's a forward and lateral bender. So when we bend down to pick up a knife or anything off the table, so you might be bending to the left a lot, or I don't know why, but it was tighter on that side. Yeah. So, obviously you want to do things straight in front of you. If you have a hard time putting your left shoe on versus your right, then that's also a clear indicator it's your left psoas. So there's a good nugget for you guys. If you have pain or stiffness putting your socks or shoes on the left leg, then it's probably your left psoas that's tight. And if you have pain or stiffness on putting your right shoe on, it's probably the right leg. If you have pain on both sides, it's probably both psoases on the left and right that are tight. And we've done some videos on psoas stretches. Make sure to check that out. Okay, your neck. We're going to do a little ART on your neck, but first I want to check your cervical rib, the first rib here. Okay. Okay, that's okay. Relax here. So she just has a couple subluxations here in her neck, a couple misalignments. Now sit up and face the camera if you could. Okay, we're going to do a little ART on her neck. And I've done videos on this to show you guys how you can do this yourself. So you're going to take your fingers here. You're going to do a tissue pull here. And then bring your head, and now pull your head away while you keep your fingers there. Now pull your head away.
Oh, sorry.
Yep. Keep going. Good. Now we're going to do another tissue pull. So you're going to go like this, and then tilt the head with it. Yep. And now pull away, and keep your hands there. Keep going. Intense, isn't it?
Yes, very intense.
And you might feel it pulling behind your ear, almost like the muscle's ripping, but it's not. Okay, now, again, I'll show you how it's supposed to feel.
It's intense.
Some people call this pin and stretch, others call it ART. It's really ART. And then right here again. Yep. And make sure you start at the top of your neck, do a tissue pull down, and tilt your head away. Actually, come on over here close to the camera and we'll show everybody. Right up here. Okay, so she's taking the flats of her fingers, pulling, starting up at the top of the neck, okay, and pulling down and then tilting the head with it. Now she's keeping these fingers still in place firmly right here. And then pull your neck away. So she's sort of pinning the muscle and then stretching and opening it up. Yep, good. See how we have these fingers holding still? Good. Now we're going to do the same thing with the other side. So the hands, yep. Tissue pull up high. She pulls down with a nice firm grip. Yep, tilts the head to that side. Now pulls the neck away. The nice firm grip. Good. And the key is getting a nice firm grip here with your fingers. And sometimes, yes, you can use both hands. So here, and then you can reinforce it with your other fingers. Yep, and pull the neck away. And do another tissue pull.
This is easier on
that
this side.
Yeah. See how she starts high, swings fingers down, anchors it with her other hand, and then pulls the neck away. That is ART. You really can do that by yourself. Awesome. How's that feel now?
Loose.
Yeah.
Looser. Yeah. Loose. Much more loose.
You feel like a bobblehead doll now?
Yeah. Nice.
Thanks for tuning in, everybody. If you have any
so much.
questions, comment below.